Hi, this is Patrick Horn, president of GAP. Thank you to our sponsor, Johnson & Johnson, for their support of this Journal Club video module.
Hello and welcome. I'm Jamie Brogan. I'm a nurse practitioner at Northwestern in Chicago, and I treat patients with inflammatory bowel disease. Today, I'll be discussing the efficacy and safety of Guselkumab therapy in patients with moderate to severely active Crohn's disease and the results of the GALAXI 2 and GALAXI 3 trials. So important to understand that Guselkumab is a dual-acting interleukin-23 P19 subunit inhibitor that potentially neutralizes IL-23 and also binds to the CD-64, which is the receptor on cells that produces IL-23. The phase 3 GALAXI 2 and 3 studies evaluated participants with moderate to severely active Crohn's disease in a randomized, double-blind, double-dummy registrational treat-through trial design of Guselkumab IV induction and subcutaneous maintenance therapy with an ustekinumab and a placebo comparator. One thing to recognize is that this was a treat-through design, so a little different than some of the other trials that we see. And important to understand, it also has a composite co-primary endpoint that looked at clinical response at week 12 with clinical remission at week 48, as well as a clinical response at week 12 and endoscopic response at week 48. This is combining both the short and long-term outcomes for our patients. And as clinicians, we understand that obtaining this endoscopic response for our patients has been shown to potentially change the trajectory of the progression of their disease by decreasing rates of flares, disability, hospitalizations, and potential surgeries. So patients pooled in the GALAXI 2 and 3 were on placebo dosing versus the Guselkumab 200 milligrams IV dosed at week 0, week 4, and week 8. Then transitioned to a 100 milligram dosed subcutaneously every 8 weeks. The next arm looked at that 200 milligram IV induction dosing at week 0, week 4, and week 8, and then transitioned those patients to a 200 milligram dose subcutaneously every 4 weeks. And then there is that ustekinumab comparator of our traditional dosing of 6 milligrams per kilogram dosed intravenously at week 0 with a 90 milligram subcutaneous dose every 8 weeks thereafter. In GALAXI 2, 49% and nearly 55% of the Guselkumab patients were able to achieve clinical response at week 12 and clinical remission at week 48 as compared to 11.8% of placebo. As for GALAXI 3, 46.9 and 48% of the Guselkumab patients were able to achieve these composite primary endpoints as compared to 12.5 on placebo. In addition, the composite co-primary endpoint of clinical response at week 12 and endoscopic response at week 48 was accomplished in 39% and 38% of the Guselkumab patients in GALAXI 2 versus 5.3 in placebo. And GALAXI 3 had 33.6 and 36% as compared to 5.6 in placebo. So we're just seeing some really strong deltas in there. As you may recall, there's also an arm for ustekinumab. So Guselkumab was able to meet all these secondary endpoints and meet superiority to ustekinumab at week 48 for endoscopic response, endoscopic remission, clinical remission at week 48, and endoscopic response at week 48, as well as deep remission at week 48. And then clinical remission at week 48 was also found in 73.8% of the Guselkumab patients. With regards to safety, the most frequently reported adverse events were COVID-19 when considering when the clinical trial was done, upper respiratory tract infections, worsening of Crohn's disease, arthralgia, and headache. There were no deaths reported. And the overall safety data for both the Guselkumab regimens through week 48 were consistent with the known and favorable safety profile of Guselkumab in its approved indications. So I want to thank you for joining me today. For more information, go to the GAP website.